Prostate health is a critical but often overlooked aspect of men's overall well-being, especially as they age. As men reach their 30s and 40s, and particularly once they enter their 50s, prostate issues become more common. Yet many are unaware of the essential role the prostate plays in sexual function and general health. Regular sexual activity, including masturbation, has been shown to have both positive and negative effects on prostate health. While the prostate is crucial in producing seminal fluid that nourishes sperm during ejaculation, maintaining its health can significantly reduce the risks of conditions like benign prostatic hyperplasia, BPH, prostatitis, and even prostate cancer. In this detailed exploration, we'll delve into how daily habits, especially masturbation, impact prostate health and offer insights on how to preserve it. The prostate, an overlooked yet vital organ. The prostate is a small walnut-shaped gland that sits just below the bladder and in front of the rectum. Despite its size, it plays a huge role in sexual health. The prostate produces prostatic fluid, a major component of semen, which helps nourish sperm and facilitates their movement during ejaculation. This fluid also contains enzymes and proteins that protect the sperm from acidic conditions in the female reproductive tract, thus enhancing fertility. The prostate, however, is not merely an accessory to reproduction. Its health is intricately linked to the body's hormonal balance, particularly testosterone and its derivative, dihydrotestosterone, DHT. DHT is critical for the prostate's growth and function, but excessive DHT can also contribute to benign prostate enlargement and increase the risk of prostate cancer as men age. As such, maintaining a healthy balance of hormones and regularly supporting the prostate through habits like masturbation may serve as a preventive measure for certain prostate-related issues. Prostate health and masturbation, how they are linked. A healthy prostate relies on the regular expulsion of prostatic fluid, a process that occurs during ejaculation. Without this natural process, the prostatic fluid can accumulate within the prostate, leading to various forms of congestion. Stagnation of this fluid can become problematic, leading to a condition known as congestive prostatitis. 1. The role of ejaculation in prostate health. Every time a man ejaculates, the prostate is actively engaged. The act of ejaculation itself involves muscular contractions in the pelvic region that help expel semen from the prostate. These contractions are essential not just for fertility, but also for maintaining the health of the prostate. The rhythmic contractions during ejaculation prevent the buildup of prostatic fluid, ensuring that the prostate remains healthy and does not become congested. Masturbation, though often seen as a personal and sometimes taboo practice, can serve as a natural means of maintaining this essential fluid flow. It's not just about the release of sperm, there's much more happening under the surface. The act of ejaculating triggers these muscle contractions and facilitates the movement of prostatic fluid, which in turn prevents prostate congestion. The impact of infrequent ejaculation, risks of prostate congestion. The risk of prostate congestion arises when a man experiences prolonged sexual inactivity, which can occur due to a variety of reasons such as stress, depression, or simply a lack of desire. If ejaculation does not happen regularly, the prostatic fluid can stagnate and accumulate, creating a condition where the prostate becomes overfilled with secretions. This stagnation, while not an infection, can lead to chronic discomfort, which many men may brush off as a minor inconvenience or something they simply have to live with. However, the long-term effects of untreated prostate congestion can evolve into more serious conditions like prostatitis or benign prostatic hyperplasia, BPH. The latter refers to the enlargement of the prostate, a condition that occurs in many men as they age, often causing urinary symptoms such as frequent urination, weak urine flow, and nocturia, waking up at night to urinate. Regular ejaculation can help mitigate these symptoms by reducing fluid buildup, which could lead to greater prostate function and overall well-being. Congestive prostatitis. the hidden consequence of neglecting prostate health. Congestive prostatitis is one of the most common conditions that arise when the prostate does not expel its secretions regularly. Unlike bacterial prostatitis, which is caused by an infection, congestive prostatitis occurs due to a buildup of fluid within the prostate. This fluid can lead to inflammation and swelling, which often results in discomfort, pelvic pain, and urinary issues. 1. Symptoms and effects of congestive prostatitis. The symptoms of congestive prostatitis can be quite distressing. Men who suffer from this condition may experience a constant feeling of fullness or pressure in the lower abdomen or pelvic area. This sensation can be especially uncomfortable during urination, and men may also notice pain during or after ejaculation. The discomfort can range from mild to severe, and the chronic nature of the condition means that it can significantly affect one's quality of life. Though congestive prostatitis is not caused by an infection, the symptoms are often similar to those of bacterial prostatitis. This includes frequent trips to the bathroom, especially at night, difficulty starting or stopping the flow of urine, and a painful burning sensation during urination. It's important to note that these symptoms may be mistakenly attributed to something less serious, which is why recognizing the importance of prostate health and taking proactive steps to maintain it is so crucial. 2. Preventing congestive prostatitis. While prostate congestion is a common condition, it's also one that can be prevented. Masturbation, as mentioned earlier, can help keep the prostate in optimal health by encouraging the regular release of prostatic fluid. In doing so, it prevents the buildup of excess fluid, thereby reducing the risk of congestion and inflammation. It is a simple, natural way to help protect the prostate and reduce the likelihood of painful conditions like congestive prostatitis. However, masturbation alone is not enough. Maintaining a healthy lifestyle, which includes regular exercise, a balanced diet rich in antioxidants, and hydration, is essential for the long-term health of the prostate. These practices help reduce the likelihood of inflammation and ensure the prostate continues to function optimally. Prostatitis, a broader concern. Prostatitis, which refers to the inflammation of the prostate, can be caused by a variety of factors. It can be bacterial, caused by an infection, non-bacterial, due to chronic inflammation or other internal issues, or congestive, resulting from fluid buildup. The non-bacterial type, particularly chronic prostatitis, chronic pelvic pain syndrome, CPPS, is common in men as they age and is frequently associated with factors such as oxidative stress, cellular aging, and the accumulation of metabolic waste products that the body is unable to eliminate efficiently. 1. Chronic prostatitis, a silent but persistent issue. Chronic prostatitis is particularly challenging because its causes are not always clear and it can persist for long periods. Symptoms may include lower back pain, perineal discomfort, and pain during ejaculation, but many men live with these symptoms for years before seeking treatment. One of the biggest issues with chronic prostatitis is that it is often misunderstood, and the symptoms are dismissed as minor, especially as men age. However, chronic prostatitis, left untreated, can lead to more severe complications, including a decline in sexual health, chronic pelvic pain, and even an increased risk of prostate cancer over time. Therefore, early intervention is key. Taking care of the prostate through regular sexual activity, a healthy diet, and proactive health care can prevent this condition from worsening. Prostate cancer, the final frontier. Prostate cancer is one of the most prevalent cancers in older men. It is often diagnosed during routine screenings, and while some forms of prostate cancer are slow-growing and may not require immediate treatment, others can be aggressive and require intervention. The connection between prostate cancer and hormonal balance is significant. Elevated levels of testosterone and DHT can contribute to the development of prostate cancer. This is why regular habits like masturbation, which momentarily reduce DHT levels, may play a small but significant role in balancing hormone levels and preventing excessive stimulation of the prostate. Though research on the direct link between masturbation and prostate cancer, prevention is still ongoing. The general consensus is that maintaining a healthy prostate through regular ejaculation and other preventive measures is essential for reducing the risk of both benign and malignant prostate conditions. The significance of prostate health. A comprehensive exploration. Prostate health is a crucial aspect of male wellness, but it's often overlooked or underappreciated until problems arise. The prostate, a small but incredibly important gland about the size of a walnut, plays a central role in male sexual health. It produces prostatic fluid, which is essential for sperm nourishment and mobility during ejaculation. This seemingly simple biological function has a deep impact on overall male health, and it deserves much more attention than it typically receives. Understanding the role of the prostate and how its health influences other aspects of male well-being is essential to preventing discomfort, pain, and more severe health conditions later in life. One of the most pressing issues concerning prostate health is the accumulation of prostatic fluid, which occurs naturally with age and sexual inactivity. Without regular ejaculation, this fluid can stagnate within the prostate, leading to a condition known as congestive prostatitis. This term describes the situation where the prostate becomes filled with thick, viscous fluid, unable to expel itself due to the lack of stimulation. This stagnation can cause a variety of uncomfortable symptoms, including pelvic pain, bladder pressure, and painful urination. Understanding how to prevent this stagnation, or at least mitigate its effects, is vital for maintaining a healthy prostate as we age. The role of ejaculation in prostate health. Ejaculation is not just about the release of sperm. It is a complex biological process that involves the prostate's active participation. Every time a man ejaculates, the prostate is at the center of the action. It produces a significant portion of the seminal fluid, which is essential for transporting and nourishing sperm. However, this fluid also serves an even more critical function. It helps to protect sperm from the acidic environment of the female reproductive tract, ensuring the survival and mobility of sperm. One of the more intricate aspects of ejaculation is the series of muscular contractions that occur in the pelvic region. These contractions help push the prostatic fluid from the prostatic ducts into the urethra, where it mixes with sperm and other fluids to form semen. When these contractions occur regularly, they keep the prostate functioning optimally. Without regular stimulation, the prostate may begin to accumulate fluid, which can become stagnant and congested. This congestion is not only uncomfortable, but can also cause more severe health issues over time. A lack of ejaculation, whether through sexual inactivity or other factors, can prevent the prostate from expelling its accumulated fluid. This creates the risk of prostatic congestion, a condition where the prostate becomes swollen and painful due to the buildup of thick fluid. Regular ejaculation through sexual activity or masturbation plays a key role in preventing this stagnation. In fact, studies have shown that men who ejaculate more frequently tend to have healthier prostates, with lower risks of developing conditions such as prostatitis, benign prostatic hyperplasia, BPH, and even prostate cancer. Prostate inflammation and the impact of hormonal imbalance. Prostate inflammation, commonly known as prostatitis, is another condition that can result from the neglect of prostate health. Prostatitis can either be infectious, caused by bacterial infections, or non-infectious, which is often more challenging to diagnose. Non-infectious prostatitis is most commonly linked to factors like oxidative stress, cellular aging, or the accumulation of metabolic waste products that the body has difficulty eliminating over time. These factors can interfere with the prostate's normal functioning, leading to chronic discomfort, pain, and even more severe health complications. Hormonal fluctuations are also a significant contributing factor to prostate health issues. As men age, their testosterone levels naturally decrease. This decline in testosterone can cause an increase in the size of the prostate, a condition known as benign prostatic hyperplasia, BPH. While BPH itself is not cancerous, it can lead to uncomfortable symptoms like frequent urination, difficulty urinating, and a weak urine stream. The changes in hormone levels can also exacerbate symptoms of prostatitis, causing the prostate to become more susceptible to inflammation and other issues. As much as hormonal changes are a natural part of aging, they can still present challenges for men. The prostate is highly sensitive to male hormones like testosterone and dihydrotestosterone, DHT, a potent derivative of testosterone. DHT is crucial for the development of male characteristics, but when produced in excess, it can overstimulate the prostate, leading to its enlargement and the onset of conditions like BPH. Understanding the delicate balance of these hormones and their impact on prostate health is key to preventing long-term issues and maintaining overall wellness. The importance of regular medical checkups and screenings. While lifestyle changes and self-care practices are essential, medical checkups are equally important in maintaining prostate health. Early detection of prostate problems is key to preventing more serious health conditions, such as prostate cancer. Prostate cancer is one of the most common cancers among men, and its diagnosis is often met with fear and anxiety. However, research suggests that frequent ejaculation may have a protective effect against prostate cancer. Studies have found that men who ejaculate more frequently seem to have a reduced risk of developing prostate cancer, although the exact mechanism behind this correlation is still not fully understood. One theory is that frequent ejaculation may help clear the prostate of potentially harmful substances that accumulate in prostatic fluid. Over time, these substances may increase the risk of prostate cancer. Though ejaculation alone cannot guarantee protection from prostate cancer, it is a simple practice that may contribute to a healthier prostate. However, it is important to emphasize that regular screenings are crucial. For men with a family history of prostate cancer, early detection through tests like the prostate-specific antigen (PSA) test can be life-saving. The PSA test measures the levels of prostate-specific antigen in the blood, which can indicate potential prostate issues. Detecting prostate cancer early, when it is still confined to the prostate and treatable, significantly increases the chances of a successful outcome. Masturbation as a tool for prostate health. Masturbation, though often dismissed as a purely physical act, can actually be a powerful tool for maintaining prostate health. Regular ejaculation, whether through sexual intercourse or masturbation, helps to maintain the flow of prostatic fluid, preventing the buildup of toxins and reducing the risk of congestive prostatitis. Masturbation, in this sense, becomes not just a release of sexual tension, but also a form of self-care that can promote prostate health. Additionally, masturbation provides an opportunity for men to connect with their bodies and become more attuned to any physical or emotional changes. During masturbation, men can notice any discomfort, swelling, or other sensations that might signal a potential problem. This awareness of one's body is a powerful tool in the early detection of prostate issues. If a man experiences pain or discomfort during masturbation or notices changes in the texture or color of his semen, these could be early signs of prostate issues that should be discussed with a healthcare provider. Moreover, masturbation can serve as a way for men to manage stress and relax. Stress has been shown to have a negative impact on prostate health, and engaging in a mindful and relaxing practice of masturbation can help alleviate anxiety and improve emotional well-being. By creating a calm, private space for self-pleasure, men can focus on their physical and emotional needs, promoting a sense of relaxation and overall well-being. The psychological impact of prostate health. Finally, prostate health is not just about physical health. It also impacts a man's emotional and mental well-being. Issues related to prostate health, such as erectile dysfunction, painful urination, or concerns about prostate cancer, can lead to feelings of anxiety, frustration, and even shame. These emotional struggles can affect a man's self-esteem, mental health, and relationships. By maintaining good prostate health, men can improve their emotional well-being, boosting their confidence and self-esteem. When men are at peace with their sexual and prostate health, they are more likely to experience positive relationships and a greater sense of self-worth. Prostate health, therefore, is not just about avoiding illness, it is also about nurturing emotional and mental balance, promoting a healthy self-image, and living a fulfilling life. Listening to your body. Recognizing early warning signs. In a world where we're often preoccupied with daily tasks and responsibilities, it can be easy to overlook subtle discomforts that might arise within our bodies. Whether it's a slight pain, an odd sensation, or a change in how we feel, many of us tend to dismiss these small signs as inconsequential. However, these could be early warning signals that something more serious is brewing. Our bodies have a unique way of communicating with us, but it's up to us to pay attention and interpret those messages. Ignoring these signals can mean missing the opportunity to address a potential problem before it escalates. This principle holds true for every aspect of our physical health, including masturbation. When you engage in self-exploration, it's an opportunity to tune into how your body feels, how it responds to touch, what excites you, and what might cause discomfort. By being aware of these sensations, you can identify when something feels off and take steps to correct it, such as adjusting your technique, changing products, or seeking medical attention if necessary. Masturbation, when approached with mindfulness, can thus serve as an early diagnostic tool to check in with your body, helping you address health issues before they evolve into something more severe. The role of hygiene in safe and enjoyable masturbation. While self-care involves physical attention, it also demands a commitment to hygiene, which is a key but often overlooked aspect of the process. Proper hygiene isn't just about cleanliness, it's about creating an environment that's safe and healthy for your body. Washing your hands before and after masturbating is one of the simplest yet most effective steps you can take to protect yourself from infections or irritations. Even though this may seem like common knowledge, the importance of maintaining hygiene cannot be overstated. When you introduce lubricants, sex toys, or other tools into the experience, this emphasis on cleanliness becomes even more critical. The skin in sensitive areas of the body can be easily irritated, especially if you're using products with harsh chemicals or fragrances. Using a gentle, skin-friendly lubricant, preferably water-based or silicone-based, can reduce the risk of inflammation, rashes, or other uncomfortable reactions. These products are designed to be kinder to the skin, ensuring that the experience remains pleasurable and free from unwanted side effects. Additionally, as we age, our skin becomes more delicate, and the tissues in our intimate areas may lose some of their elasticity and resilience. This makes it even more important to select products that are designed for sensitive skin and to maintain proper hygiene throughout the process. Incorporating these practices not only enhances the experience, but also prevents potential health concerns from arising. Creating the right atmosphere. The power of relaxation. One of the most important elements of a fulfilling masturbation experience is taking the time to relax and set the mood. It's easy to think that the physical act alone is enough, but the mental and emotional state you bring to the experience can greatly enhance the pleasure. Before engaging in self-exploration, try engaging in activities that calm your mind and body. Whether it's deep breathing, meditation, or simply soaking in a warm bath, these acts of relaxation help you become more attuned to your body and more present in the moment. Relaxation serves a dual purpose. It allows you to reduce stress, making it easier to enjoy the experience, and it helps you become more connected to your body. When your mind is at ease, you are able to focus more on the sensations in your body, rather than being distracted by outside stressors. The more relaxed you are, the more likely you are to experience heightened pleasure, greater satisfaction, and a deeper connection with yourself. The process of setting the right atmosphere, lighting candles, dimming the lights, playing soothing music, can also help you build a sense of comfort and intimacy with yourself. These external factors influence your internal state, creating an environment that encourages exploration, relaxation, and enjoyment. When masturbation becomes an intentional, mindful practice, it moves beyond a purely physical release and becomes a holistic experience for both body and mind. Mindfulness, exploring your desires and boundaries. Masturbation, when approached with mindfulness, can also be an opportunity for profound self-discovery. Rather than rushing through the process, it's about taking the time to reflect on what excites you, what doesn't, and how you feel throughout the experience. By paying attention to your body's signals, you learn more about your desires, boundaries, and preferences. This awareness is an important part of developing a positive relationship with your body. When you take the time to be mindful, it helps you develop a sense of acceptance and understanding of yourself. This exploration can also encourage you to experiment with new techniques, fantasies, or sensations, preventing the experience from becoming monotonous or routine. It's crucial to approach masturbation without guilt or shame. These feelings, often influenced by societal pressures and misconceptions about sexuality, can hinder your ability to fully embrace and enjoy the experience. By reframing these emotions and treating them with curiosity, you can release the negative connotations attached to masturbation. This practice is a form of self-love, a way of nurturing and accepting your body and sexuality with openness and compassion. When masturbation becomes a coping mechanism, balancing the practice. While masturbation is a natural and healthy part of life, it's essential to maintain balance. Like any practice, it can become problematic if it is used to fill emotional voids or avoid deeper issues. If masturbation starts to replace meaningful connections with others, or if it becomes a way of coping with stress or emotional pain, it's important to reassess your relationship with it. Masturbation should be a fulfilling and enjoyable part of your life, but not something that detracts from other areas of personal growth or emotional well-being. If you find that it's becoming a crutch or a way of avoiding important emotional work, it might be time to take a step back. Exploring other forms of self-care, such as connecting with loved ones, engaging in creative pursuits, or seeking therapy, can help address the root causes of these feelings and allow masturbation to remain a positive and nurturing experience. Masturbation as a healthy form of self-care. At its core, masturbation is a practice of self-love and self-care. It offers an opportunity to explore your body, understand your desires, and practice healthy habits that support your overall well-being. When approached mindfully, masturbation is not just a physical release, but a way to cultivate a deeper connection with yourself. Whether it's through improving hygiene, setting the right mood, or embracing the practice with curiosity and without shame, masturbation can be a profound act of nurturing. Incorporating these mindful practices into your routine allows you to care for your body in a way that fosters both physical pleasure and emotional health. By honoring your body and embracing your sexuality with love and understanding, you transform masturbation into a valuable, holistic self-care practice. Final thoughts. Self-care is personal, sacred, and beautiful. As we conclude, it's essential to recognize that masturbation is more than just a solitary act. It is an opportunity for self-discovery, relaxation, and care. The more we embrace this practice mindfully, the more we can learn about ourselves, our bodies, and our desires. Whether it's through recognizing the early warning signs of discomfort, maintaining hygiene, or creating a relaxing atmosphere, these small, intentional steps can elevate the experience. By practicing self-love and acceptance through masturbation, we foster a healthier, more positive relationship with ourselves, one that prioritizes both physical and emotional well-being.